Disregard, ignore, obsessions. It seems that ignoring obsessions is an easier task to achieve if obsessions are only mild. However, even those with severe or even extreme OCD can eventually use this strategy effectively. As we know and understand, obsessions are completely unwanted and they are very intrusive. Anybody can have unwanted thoughts, of course, and obviously you do not have to have OCD to experience unwanted thoughts. I'm sure we have all had unwanted thoughts, even if these thoughts were along the lines of horrid dreams or nightmares. It is normal. Most people, while experiencing unwanted thoughts in an awakened state, would ignore thoughts that are unpleasant. They would pay them no attention. They may recognize them, but quickly dismiss them. Of course, thoughts can come into anybody's mind, and sometimes a thought that just pops into one's mind may have an element of pleasure, such as suddenly thinking about taking a vacation, a thought out of the blue. Therefore, such thoughts may not be unwanted. Perhaps somebody who has an unwanted thought which is more or less unwelcome might experience a thought that has some sort of feel-good factor or a tinge of pleasure about it, such as if a person is trying to abstain from alcohol, they will most likely have many unwelcome thoughts about having a drink, yet the thought of having a drink still has an element of pleasure, whether it be thinking about the taste, forgetting one's problems, or whatever, as there is this element of a feel-good factor or something that may be desirable, such as the temporary feeling accompanying alcohol consumption. So, anybody can have thoughts which are unwanted whether there is a touch of this feel-good factor to it or not. Anybody can experience an awful thought such as hurting somebody or the like. However, most people dismiss such thoughts and are no longer bothered much by them. Their brain is able to deal with such unwanted thoughts or push them aside, and the person may think something such as, "What a horrible, silly thought. Where did that come from? Ah well, forget about it." People with OCD can find this very, very difficult to do though. Obsessions have 4 characteristics. They are unwanted, 100% unwanted, intrusive, inappropriate, and reoccurring. Anybody can have thoughts that carry the first 3 characteristics. An example could be that a person suddenly has an intrusive and unwanted thought about jumping from a high place or pushing somebody off from a high place, which is inappropriate as it goes completely against their wishes and there is no reasoning behind it. The 4th characteristic, reoccurring thoughts, is where a person with OCD gets really stuck. The thoughts are not only 100% completely unwanted, there is no feel-good factor in any obsession, inappropriate and intrusive, but the thought just does not go away despite all efforts. How then can we do anything about making these unwanted thoughts go away? We can dismiss such thoughts, but it can take a lot of practice for a person with OCD. There are reasons for this in relation to functioning within the brain due to abnormalities such as in the basal ganglia. However, without getting bound up in explanation of causes, we want to know what to do and how to do it. It can be such a miserable and painstaking battle for somebody with OCD to do this strategy effectively, disregard/ignore obsessions. However, I think personally that once a sufferer of OCD, more so in moderate to extreme cases, can get some help from a fully competent therapist trained in practicing therapies for OCD treatment such as ERP, exposure and response prevention, then one can gradually learn to effectively ignore obsessions. Just simply ignoring obsessions can take a long time/a lot of practice to master. Speaking from a psychological point of view, there is a term known as habituation stemming from CBT, cognitive behavior therapy. It is basically when there is a decrease in responding to something with repeated stimulation, or getting used to something, in where something may appear novel at first, but after repeated exposure of this novel thing, whatever it may be, one tends to lose this novel feeling and the response to the stimuli is lessened. And, of course, this stimuli does not have to be novel, it can very much be unpleasant, but one just tends to get used to it, and in where the result is a reduced response, like saying, "Oh, that again, it is nothing new anymore." Therefore, a person with OCD may experience unpleasant, unwanted thoughts and gradually adopt this habituation process, yet it can seem seemingly impossible for the sufferer of OCD due to the makeup of the brain in a person with OCD. Yet, with solid guidance from a competent psychologist or the like, and with dedication, hard work, tolerance, and practice, on behalf of the sufferer, a person with OCD can gradually adopt this strategy of ignoring obsessions and thinking something such as "what a silly thought," go away and push it aside immediately. It can be done, and it can be so difficult to do that it seems almost impossible to express in words how difficult it can actually be, but this strategy is attainable, one little step at a time, and with specific techniques that a psychologist may use through ERP. One can adopt such philosophies to the type of thinking where one says something such as "oh, another silly OCD thought, huh," and immediately turn their attention to something else. ERP, to put it simply, involves the sufferer of OCD being deliberately exposed to their obsessions and prevented from acting on them. The sufferer's attention is diverted immediately from obsessive thoughts or ideas. So, in a way, ERP is sort of like ignoring obsessions, yet they are certainly acknowledged, and in a way the general strategy of ignoring obsessions and paying them no attention can be likened to how obsessions are dealt with in ERP: pay them no attention, do not engage in thinking about them. Thoughts come into one's mind, but do not act on them, dismiss them and treat obsessions like a person you want nothing to do with, tell them to go away immediately. In saying this, it is absolutely imperative, speaking from my experience as a patient of 4 years of therapy for OCD, that unwanted thoughts in the form of obsessions are dismissed immediately, meaning that yes, the thought will come and this is to be acknowledged, but turn your attention away immediately with no delay. Once the obsessive thought or idea is entertained, or as soon as one responds to it, as in engaging in compulsions, it will be even more difficult to deal with. This strategy, ignoring/disregarding obsessions, can be very, very difficult, but again, with good guidance from a therapist while practicing philosophies of ERP, obsessions can actually be ignored, not all the time, as OCD is recognized as a lifelong waxing and waning condition, and factors such as stress can be a legitimate trigger for stronger obsessions, but overall with practice and help one can learn to think something like "I will not give you any more attention, go away, now." Once you have had some success with this strategy, as long as it may take, you will most likely find it less difficult to ignore obsessive thoughts or ideas. Give it a go and don't give up. All the best, you can do it.